Hello everyone. Welcome to Autism Mind and Life, the channel where we aim to share important content about autism to enrich knowledge, improve the quality of life for autistic individuals, and raise awareness. Let me ask you a question. Have you ever wondered about the difference between autism and ADHD in children? Often, these two disorders can present similar symptoms, making diagnosis and appropriate treatment challenging. That's exactly what we're going to talk about in today's video. So, stay with us until the end of this video because I'm sure you'll learn valuable information that can make a difference in the life of a child. Understanding autism. Autism spectrum disorder, or ASD, is a neurological condition that affects a child's development, primarily in the areas of communication, social interaction, and behavior. Children with autism may have difficulties in communicating, both verbally and through gestures and facial expressions. They may also struggle to understand and appropriately respond to the emotions and intentions of others. Furthermore, children with autism often exhibit repetitive behaviors and restricted interests. They might fixate on specific objects, follow rigid routines, and have difficulty dealing with changes in their daily routine. These behaviors can be a way to find comfort and predictability in a world that may seem confusing and overwhelming to them. It's important to highlight that autism is a spectrum, meaning each child with autism is unique and may exhibit a different combination of symptoms and abilities. Some children with autism may have exceptional abilities in specific areas, such as music, art, or mathematics. Signs of autism usually appear in the first few years of life, and parents are often the first to notice unusual behaviors in their children. Some early signs may include delays in speech development, lack of interest in social interactions, repetitive movements, and hypersensitivity to sensory stimuli. A recent study published in the journal JAMA Pediatrics in 2021 suggests that early intervention can significantly improve developmental outcomes for children with autism. This underscores the importance of identifying signs of autism as early as possible and seeking appropriate support for the child and their family. With proper intervention and support, many children with autism can develop social, communication, and coping skills to help them thrive. Understanding ADHD now, let's talk about attention deficit hyperactivity disorder, better known as ADHD. It is a neurobiological disorder that affects both children and adults, characterized by symptoms of inattention, hyperactivity, and impulsivity. Children with ADHD may have difficulty maintaining focus on tasks, appear not to listen when spoken to directly, and get easily distracted by external stimuli. They may also be excessively active, running or climbing in inappropriate situations, and have trouble playing or engaging in leisure activities quietly. Impulsivity is another common symptom of ADHD. Children with this disorder may talk excessively, interrupt others, have difficulty waiting their turn, and act without considering the consequences. There are three main types of ADHD: predominantly inattentive, predominantly hyperactive, impulsive, and combined. The inattentive type is primarily characterized by symptoms of inattention, while the hyperactive, impulsive type is dominated by symptoms of hyperactivity and impulsivity. The combined type exhibits significant symptoms of both inattention and hyperactivity, impulsivity. It's important to remember that all children may exhibit some of these behaviors at some point, but for a diagnosis of ADHD, the symptoms must be more frequent and severe than expected for the child's age and must cause significant difficulties in at least two different settings, such as at home and at school. Key differences between autism and ADHD. Although autism and ADHD can present some similar characteristics, there are important differences between these two disorders. Let's explore some of the main differences. First, let's talk about communication and social skills. Children with autism often have significant difficulties in social communication and interaction. They may struggle to initiate or maintain conversations, use and understand nonverbal language such as gestures and facial expressions, and share interests and emotions with others. Children with ADHD, on the other hand, may be very talkative and even interrupt others, but they generally do not have the same fundamental difficulties in social communication as children with autism. Another important difference lies in repetitive behaviors and restricted interests. Children with autism often exhibit repetitive movements, such as hand flapping or body rocking, and may intensely fixate on specific subjects or objects. These behaviors and interests can be a source of comfort and security for them. While children with ADHD may have some repetitive behaviors, they are generally not as intense or restrictive as in autism. Hyperactivity and impulsivity are more commonly associated with ADHD. Children with ADHD often seem to be on the go, having trouble staying still and waiting their turn. They may talk excessively and act without thinking. Although some children with autism may exhibit hyperactivity, it is not a core symptom of the disorder. It's crucial to note that autism and ADHD can coexist. Research conducted by the Centers for Disease Control and Prevention, CDC, in the US in 2020 revealed that approximately 1 in 54 children is diagnosed with autism spectrum disorder, ASD. Studies also show that ADHD is more common in children with autism than in the general population. Due to the overlaps and differences between autism and ADHD, accurate diagnosis is essential to ensure the child receives appropriate support and interventions. An accurate diagnosis can help parents, teachers, and healthcare professionals better understand the child's unique challenges and develop effective strategies to support their development and well-being. Diagnostic process: getting an accurate diagnosis is crucial for children with autism or ADHD. A correct diagnosis can open doors to services, therapies, and support that can make a big difference in the life of the child and their family. The diagnostic process typically involves a multidisciplinary team, which may include a pediatrician, psychologist, neurologist, and other specialists. These professionals will gather information about the child's development and behavior through observations, assessments, and interviews with parents and other caregivers. It's important to remember that there is no single medical test to diagnose autism or ADHD. The diagnosis is based on clinical observations and specific criteria described in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Understanding the differences between autism and ADHD in children is crucial for providing the right support and ensuring healthy development. Have you been able to identify these differences in any child you know? How can you use this knowledge to help in seeking an accurate diagnosis and effective interventions? To continue expanding your understanding, I invite you to watch our video, Understanding Nonverbal Autism: Challenges and Strategies. It's an excellent opportunity to learn more about how to support children facing communication challenges. And of course, don't forget to subscribe to the channel, like the video, share it with friends, and turn on notifications so you don't miss any new content. Let's turn knowledge into action and create a more welcoming and understanding environment. What was your biggest discovery today? Leave your answers and suggestions in the comments. See you in the next video.